Review the order and indication for indwelling catheter and gather equipment.
Oh, okay. I see I have an active order from Lisa Williams for inserting an indwelling urinary catheter now for Sydney Tucker. Because the patient has been oliguric and the team wants stricter monitoring of urinary output. So I will put the indwelling urinary catheter in as per the provider order.
Perform hand hygiene. Introduce yourself.
Hi, Sydney. My name is Nancy. I'm going to be your nurse today.
Identify the patient using 2 patient identifiers.
Could you just tell me your name and date of birth? I'm going to check it against your band here. Okay, Sydney Tucker. I see date of birth 6/12 XXXX. Does that match? Yes. Okay.
Provide privacy for the patient.
I'm going to go close the door.
Explain the procedure to the patient.
Sydney, the doctor really wants to keep close track of your urine output. And we are going to put in a tube into your bladder through your penis to keep track of every single drop of urine so that, we can really make good decisions about your care. It's going to be a little bit uncomfortable, but we'll talk you through the whole thing. Are you allergic to anything? Iodine or latex? No, that's good. Okay.
Assist the patient into a supine position with thighs apart.
I'm going to just lower your head, Sydney. I'm going to just open your legs a little bit so that I can work in between there. Okay.
Put on clean gloves. Cleanse the genital area.
Okay, I'm just going to clean you down here, Sydney, with some cold wipes. I'm so sorry.
Cleaning the tip of the penis first in a circular motion from meatus outward to shaft and then pubic area. Remove gloves and perform hand hygiene. Open sterile catheterization tray on a clean overbed table using aseptic technique. Don sterile gloves. Place sterile drape between the patient's thighs. Place a fenestrated sterile drape over the perineal area, exposing the penis. Move sterile tray from overbed table and place on the blue sterile drape between the patient's thighs. Open sterile cleansing solution. Attach attach syringe filled with sterile water to the catheter's balloon inflation port. Deposit lubricant from syringe onto tray. Remove catheter from the sleeve and place in lubricant. With your non-dominant hand, lift the penis, retract the foreskin if present, and identify the meatus. With your dominant hand, pick up a new sterile antiseptic swab and clean the penis in a spiral fashion, moving from the meatus down the glans and discard. Still holding the penis with your non-dominant hand, apply a gentle upward tension. Using your dominant hand, hold the sterile catheter 3 to 4 inches from the catheter tip and insert slowly into the urethra until there is a return of urine.
I see urine.
Advance the catheter another 7 to 10 inches. Without removing your non-dominant hand, pinch the catheter securely at the meatus with your thumb and forefinger. Use your sterile dominant hand to fully inflate the catheter balloon. Using your non-dominant hand, gently tug on the catheter after the balloon is inflated to check for resistance. Replace the foreskin if present. Remove the syringe from the port. Remove and discard equipment. Remove soiled gloves and perform hand hygiene. Put on clean gloves. Secure catheter tubing to the patient's inner thigh with a catheter securing device. Ensure there is no tension on the tubing. Assist the patient into a comfortable position. Remove gloves and perform hand hygiene. Document the procedure.
So I'm going to document that I inserted a 14 French Foley catheter, that there was 200 milliliters of clear yellow urine, and that the patient tolerated the procedure well.